What's good, family? Today, we are talking about hypochlorhydria, a condition where the stomach acid falls too low. One of my biggest pet peeves is when providers prescribe azoles and acid reducers for acid reflux, bloating, and indigestion without addressing the root cause. Many people mistakenly believe that too much acid is the cause of their issues, but in reality, it is often too little acid. This is not a condition to ignore because low stomach acid is associated with chronic issues such as improper digestion of certain proteins, reduced ability to absorb nutrients, pancreatic dysfunction, B12 deficiency, pernicious anemia, mineral deficiencies, increased risk of infection, ulcer formation in the stomach, autoimmune diseases, and inflammatory skin conditions. If you have this condition, you probably often experience symptoms such as gas, belching, heaviness in the body, bloating after meals, and indigestion. Does that sound like you? When stomach acid is low, food sits in the stomach without proper digestion, leading to these symptoms and making individuals feel worse after eating. The usual management is typically antacids and proton pump inhibitors, but does that sound like the right approach for this condition? Not really. Let's discuss the signs and the symptoms of low stomach acid that your body is probably screaming out about, but you're not paying attention. Hair loss, soft or brittle nails, joint aches, muscle weakness, blood vessel issues, acne, and even anemia can be signs of low stomach acid. Those are common complaints, and I'm sure many people watching this video have at least some of those issues. But before you run to your doctor's office, it's important to note that not all healthcare providers know this condition. It is rarely discussed in healthcare unless that provider is trained in functional medicine and focuses on the root cause. But my goal is to help you take control of your health and be able to identify the things that may be causing certain issues. Let's start with the general lab test. If you have low stomach acid, you may notice increased MCV and MCH, decreased calcium, iron, chloride, alkaline phosphatase, total protein, albumin, increased BUN, and decreased serum phosphorus on your lab results. But keep in mind that other factors may also cause these results. Now you're probably thinking, well, even if I do have low stomach acid, how did I get here? I mean, I am so healthy, I do all the right things. I have been eating healthy for like 2 weeks. I don't even drink alcohol, except for like 2 to 3 weeks ago when I binged the Casamigos. But other than that, I am super healthy. You know, our body has a very interesting way of telling on us, if not just telling us what we need to know so we can act on it. But the typical root causes of having low stomach acid include aging, increased stress, consumption of refined carbs like pastries, cakes, white pasta, white bread, white rice, and candy, certain medications such as antacids and acid-blocking medications, low protein intake, and marijuana use. So if you are having gastric symptoms or any issues at all with your gut, please don't leave out the fact that you use marijuana because that is one of the root causes of a few gastric issues. Additionally, chronic overeating and emotional stress can contribute to low stomach acid. Did you know several very common conditions are linked to low stomach acid, including diabetes, childhood asthma, hypo or hyperthyroidism, eczema, other skin conditions, gallbladder disease, hepatitis, osteoporosis, chronic autoimmune disease, adrenal exhaustion, and chronic gastritis. So if you have one of those conditions, do your research. If you're dealing with any of this, it's time to address the root cause and build up that stomach acid. Let me break it down for you and give you some personalized treatment options. First up, we got that apple cider vinegar. Dilute a teaspoon of vinegar in your water or drink with each meal. This helps increase your hydrochloric acid, which is what we need. If you see some improvements but it's not hitting the spot yet, don't worry. You can bump it up to 5 to 10 teaspoons. That's where the real benefits kick in. Now, let's talk about those vitamins. Make sure you're not lacking in vitamin B12 or folate because that's linked to low hydrochloric acid. Get yourself a multivitamin with minerals. Look for one with at least 1,000 milligrams of calcium, 500 milligrams of magnesium, 400 IU of vitamin D, 100 to 200 micrograms of chromium, 100 to 200 micrograms of selenium, 5 to 10 milligrams of manganese, and at least 15 milligrams of zinc. Now, I want to put you onto some digestive enzymes. I personally love plant-based ones because they're easy on the stomach. Protease and lipase are the ones you want to look out for. They'll take care of your enzyme needs and help neutralize the environment in your intestines. Trust me, they're a game changer. And don't sleep on the bitters. Swedish bitters or any kind of bitters, they stimulate hydrochloric acid production. You can take them in tablet or liquid form, whatever you prefer. Now, let me tell you about some herbs. Gentian root, scutellaria, and golden seal are my go-tos for low acid. But if you can't find golden seal, don't stress. Oregon grape root is a good alternative. Now, if things are really rough and you need that extra boost, there's something called betaine. This is a powerful treatment, but I only recommend it when you have extra supervision. It can be a bit uncomfortable, so make sure you talk to your healthcare provider and get their input on it. I hope this info gives you some extra tools to understand why you're worried and how to handle it. Just remember, there's usually some tricky stuff that needs to be looked into, and it's crucial to stand up for your own health. Thanks for tuning in, and if you haven't yet, be sure to subscribe to the channel and check out rootedvigor.health for more helpful content. Take it easy.